Good day, everyone. Tom Kuzma here with Buffalo Chiro Clinic, and I'm here to talk with you about something that everybody has heard of, everybody knows of, but I don't know the depth of your knowledge of it. So either way, I'm going to pretend like you don't know a thing. So we're going to talk about tendons, tendonitis, and tendinopathy. Three things that we see a lot of in our office here. So a tendon, first of all, is what attaches a muscle to a bone. So take your bicep here, this bulging bicep. So you get the meaty part of the muscle right here, and then you have a tendon that muscle will turn into, and that's what attaches, goes from about here up to the attachment point, and that'll cross over your shoulder joint up here, and that will help move your arm up and down. Same with down here with the bicep in particular, that will cross over the elbow joint as well, and that will allow for this motion. Now when you overexert yourself, that's when the tendon gets angry. It's kind of the weak part of the muscle in itself. So you have the bone, tendon, then turns into that big bulky muscle. When that muscle gets really strong, sometimes the tendon doesn't come along with it, and that becomes inflamed, and that's what we call tendonitis. So the tendon is just a normal thing. That's just what connects the muscle to the bone. When it gets inflamed, that's what tendonitis is, and that hurts. It's not comfortable. You feel it in like tennis elbow. A lot of times we'll get tendonitis right in there. All that is inflammation because that tendon is being overused, right? Now overuse and strains are kind of one and the same thing. So a strain, you guys have all heard of a strain, right? So now I get to draw a little bit. I have my coloring pad out. So a muscle, the fibers are all lined up in a nice straight line. That is not the best marker in the world, but it's going to have to do. There we go. So nice straight line. This is a nice healthy muscle right here. Now, if you get strained or if you have an injury in that muscle, you tear a fiber. You tear a fiber there. Sometimes you'll tear a couple of them. So then all of a sudden we have these muscle fibers that aren't functioning. Those aren't doing anything over here when you go to contract, and that becomes angry. It becomes inflamed. Blood comes into the area. That blood is there for a purpose. So that blood's going to help heal that wounded area. That's what brings in your mRNA and all like the proteins that will help bind and create more muscle. So it's a good thing. That's how you build muscle, because eventually that will hypertrophy if it's treated right, and then you'll have more fibers in here, and that will allow for a stronger muscle. So that's how you build muscle. But if you get a tendonitis, if you have an injury kind of, or an overuse type thing that hurts, and then you say, I don't want to use that anymore because it hurts, that's when it becomes tendinopathy. So then this little broken muscle fibers here, those instead of getting stronger and healthier, they're going to become fibrotic and full of scar tissue. All right, so the scar tissue will not form in nice linear paths. Instead, it will go every which way, and then it becomes this big knot, or they call it an adhesion, and eventually that adhesion will shorten the whole length of the muscle, right? So that muscle is attached to, say you got your elbow down here, elbow, and you got your shoulder up here. So you have this whole muscle that has this pathway. If that muscle is shorter, that is not going to allow for the same amount of strength or range of motion. So you'll have lack of range of motion. It won't move as far as it should, and it will become inflamed more often. So that is what we treat in our office often. That's scar tissue. That's something that's been there from an old injury that just never was worked out. So best way to work it out is to just push on that baby and try to squeegee out some of that muscle fibers. So we use Graston technique and EPAT, something you need to look into here if you have something like this, because it works amazing for it. But I just wanted to explain what tendons, tendonitis, and tendinopathy is. Long-term effects of tendinopathy can result in early degeneration, arthritis, all these things. So you have the muscle that crosses the joint. Say it's your quadricep or your hamstring. Say that muscle's too tight, it's shortening things up. That's going to ram that femur head right up into that socket. It's going to compress that more. You have more stress on it. More stress leads to early degeneration. So take care of your tendons, take care of your muscles, stretch, be happy.